Regarding the cemented stem, it's made of stainless steel or cobalt chrome. It is more rigid than an uncemented stem. Cement mantle should be about 2 to 3 mm. Reduced cement mantle is used by some surgeons as a concept of French paradox. Titanium is less stiff, leading to cement fracture and prosthetic cement failure. Avoid various positioning of the stem by starting most lateral entry point. The entry formed between the medial endosteal cortex and the femoral shaft is an angle which is called femoral stem varus angle. This should be always less than 5 degrees. Cemented stem is better in osteoporotic and irradiated bones. Antibiotic can be used in deep infections and reduce mechanical strength. Cemented stems are smaller than press fit and unable to tolerate as much cantilever bending. Mantle defect is an area where prosthesis touches the cortex with no cement in between. A 3M THR failed. 3M capital THR was failed because a Charnley design was made by titanium and has a phalange proximal path, where particles of titanium initiate inflammatory reaction and early loosening and failure. That started the NJR history. Regarding hydrogen peroxide promotes hemostasis, allows strong cement bone interface. Injecting into closed cavity can risk gas embolism. Use suction catheter to avoid to vacuum and use only less than 1.5% strength.